Hi everyone, welcome to Research MD. Today we're going to continue our topic discussion on in-service training examination questions in internal medicine. Again, my name is Dr. Pramil. I am a program director in internal medicine residency, also a chief medical officer in one of the large health system in the United States. So the topic today, before I go, an in-service training exam, a lot of people take very lightly and they don't pay attention, but they have huge implications, and make sure you study well. And some of those questions are, the topic is coming from in-service training examination. Okay, so today's topic, the question is about hepatorenal syndrome, how to manage in the setting of spontaneous bacterial peritonitis. When you talk about hepatorenal syndrome, the reason is very critical, because when a patient comes with cirrhosis and you diagnose hepatorenal syndrome, the mortality is almost like close to 90%. So what is the best way to treat them? So we're going to ask about a question. A 55-year-old woman with a known cirrhosis present with acute kidney injury. She has stopped diuretic, but her serum creatinine continued to rise. Her labs are sodium 128, creatinine 2.5, albumin 2.0. Urine output is slow. So we got four options. One is start terlipressin and albumin. Number two, start IV fluids and furosemide. Number three, hemodialysis. Number D, liver transplant immediately. Okay, so the answer to the question is, there was a great study published in New England Journal of Medicine about the role of terlipressin and albumin in the treatment of hepatorenal syndrome. Okay, so your first answer is, when you see hepatorenal syndrome and the board or in-service training exam is asking you, you should pick a combination of terlipressin and albumin. A lot of people is going to pick only albumin. No, terlipressin, good statistical evidence-based effort to find out is this the best way to treat. Okay. Now, if you look at the management, first when you have a patient hepatorenal syndrome, we have to make sure treat precipitating condition, and there's a lot of other options, but we will come back. If they have SBP, you need to treat them with antibiotic for SBP, and so let's look at some of the other questions. Okay, and when you manage these people, always make sure. Don't forget about, if they're SBP, you have to start first spontaneous bacterial peritonitis, albumin, and the terlipressin. That is the treatment. So now let's look at some other options. It's like everything fails, then you can do liver transplant. And some of the patients you can go for hemodialysis also. Okay, we're going to look at the next question. A 60-year-old man with cirrhosis, spontaneous bacterial peritonitis, diagnosed with hepatorenal syndrome. He's already on cefotaxime for SBP. His lab, sodium 127, creatinine 2.8, albumin 2.0. So what is the next step in the management in this patient? Again, you know it. Don't forget terlipressin, vasoconstrictor plus albumin. That is the answer. Okay, so next question, a 62-year-old man with cirrhosis and spontaneous bacterial peritonitis, treated with antibiotics and albumin, blood pressure is low, renal function continued to decline, terlipressin is unavailable at your hospital. Remember, they clearly say terlipressin is not available, but because they know that is a treatment. What is your best alternative treatment in this time? The blood pressure is low. Everybody know you have to give pressors, so you give norepinephrine. Okay? Now, next question. A 48-year-old man with cirrhosis developed hepatorenal syndrome. He also has SBP. Serum creatinine is 3.0. They gave albumin, terlipressin. Renal function improved. So, what is the next step in the, is renal function improved? What is the next step in management? These people, for permanent cure, you need like a liver transplant, right? They are end-stage liver disease. Nothing is going to help. You need liver transplant evaluation. Okay, even if they improve, the end of whenever a patient with hepatorenal syndrome, they have highest mortality. They'll buy you a little bit of time with the other thing, but they should be evaluated for liver transplant. Don't forget that. Another patient, a 60-year-old patient with a cirrhosis and low urinary output, hepatorenal syndrome, despite they gave norepinephrine, albumin, renal function, still not improving. Creatinine is climbing up. What to do? In this case, you should start hemodialysis. Okay, that is the answer. What you need to understand, again, hepatorenal syndrome, board and the in-service training exam is going to talk to you about terlipressin plus albumin. That's the whole take-home message from this. Okay? So that's what the question is going to be. Thank you so much for watching. We'll be back with another presentation. God bless.